I'm Dr. Lee Sheldon. Thanks for making the appointment to come to the dental implant lecture. For some reason, you weren't able to come, but I wanted you to see some of the highlights so that you can make some decisions for yourself with regard to dental care. I hope this helps, and if you need to get in contact with us, just give us a call at our office, 321-259-8000, 321-259-8000. We'll be happy to answer any questions that you have. In addition, you missed out on our book. We have the book, The Ultimate Mouth Manual, and if you just give us a call, you want to find out, do a little bit of reading about what can happen in advanced dental care. It's a good book. How do I know? We all wrote it, so, and we think it's good. But it's written in little chapters, little 500-word essays, so that you don't have to read the entire book. You only have to look up the particular problem that you have, and you'll be able to find an answer for that. So we'll briefly go over the seminar. I'm not going to do the whole thing. This is an online meeting, so we'll try to get through this quickly. So there are the three of us. On the left side is Dr. Matt Sheldon. On the right side is Dr. Michelle Furtado, our board-certified periodontist. Matthew is a general dentist who's trained with an advanced education in general dentistry degree, which means that he was trained beyond dental school, and he continues to take continuing education with some of the best, most advanced people in the country. Dr. Furtado, 3-year residency after doing a lot of research at the University of Toronto. Has been a dentist since 2003 and became board certified periodontist, and that's one differentiating factor. Did you know that anybody can do dental implants? You can take as little as a 3-day course to do dental implants. So Dr. Furtado took a 3-year residency, 3-year surgical residency, and became board certified. That's one of the problems in dentistry. 3 days, 3 years. Is there a difference? Well, I think you can be the judge of that. The fact is that we are trained. We are specialists in our office, and there is a difference. The lecture I talked about the fact that, let's assume you have a heart problem, and you go to the cardiothoracic surgeon, and the cardiothoracic surgeon is all prepared with all of his testing materials, all ready to be able to deliver the service that you need with a cardiac bypass. And imagine going to that cardiologist, or looking at the cardiologist in the eye, and says, I think I'm going to go back to my general physician and see if he can give me a better price. That's exactly what's going on in dentistry right now. So we'll talk about price, but not a lot. That's something that we can talk about. Everybody's interested in fees. Just so you know, I'll tell you right off the bat. If you take a look at some of those, the ads on TV, we're talking about extraction of all the upper teeth, extraction of all the lower teeth, and putting in dental implants, and putting upper and lower fixed prostheses, and you see all of these nice smiles. Yeah, we do that too. We do that for a long time. But it comes at a cost, and the cost is about $50,000 to get that done. Sometimes a little bit less, sometimes a little bit more, depending upon what's necessary. What's interesting is that when patients see us, they have options. Those places that are advertised on TV, there's only one option: extract the teeth, put in implants, and put in teeth. In our office, you have both options. There are a lot of teeth that can be saved, and saved in comfort and in health for a long period of time. They don't need to be extracted. What we need is the diagnosis. We need the treatment plan. We need to be able to look at a patient and to be able to see what needs to be done. And if you say, I've had it done already, the answer I give you is you have not had your mouth looked at by a specialist. And if you haven't had your mouth looked at by a specialist, trained well beyond dental school, seeing the most complex cases, then in fact you haven't had a full view. And that's the advantage that we offer. We can do everything that those people advertise on TV. In fact, and as I said, we've been doing it for a long time. But we also have a number of people who can save their teeth. They can save their teeth in health. And perhaps save a lot of money, and it's importantly, save your teeth. So if you're looking at us, you're looking at us not just because we're surgically qualified, not just because we have surgery and restorative dentistry all under the same roof, not just because we have two specialists in our office. You're looking at us because we are diagnosticians. That it is not a one-size-fits-all treatment in our office at all. It's not a quick visit and then go to financial arrangements. It's let's consider your options, let's look at the different possibilities, and let's plan together what can be done in your mouth. So if you're looking, I know you're interested in dental implants. So if you're looking at dental implant treatment, you're going to go anywhere from a minimum of $5,000 up to $50,000, and it really depends upon what you need. So beyond that, we can talk about it when you come here. And when you come here, it's simply donate $50 to one of the 8 charities in our charitable giving campaign, and you'll get the complete examination, x-rays, CT scan, full diagnosis and treatment plan. And of course, the charities will benefit, and so will you. Our charitable giving campaign has collected now well over $180,000 for our local charities. So we're proud of that, and you can take advantage of that just by saying that you attended the webinar. Even this webinar, even though you didn't, or even though you didn't attend the lecture, just say I attended the webinar, you'll qualify for that special offer. Okay, so let's move on with some of the material, and let's just look at what is here. So I want to introduce you to Amy. Amy has been a patient of ours, and she came in and she had a problem. Obviously, she didn't like her smile. Now, Amy's story really is she had just gotten a divorce. She had told her husband she wanted a nicer smile. Her husband told her to get a denture. Amy said, I don't want a denture. That's only the only option. Her husband left her and married somebody with a pretty smile. So Amy said, I'm ready. I'm ready to do something. And so what we did with Amy is we put her in one of our, we took her picture and we used one of our imaging programs. And that imaging program will show you and show us exactly what Amy could look like, or maybe not exactly, but give an example of what Amy could look like. And so you see what we're doing is simply tracing out the smile. And then we're inserting teeth from a library of teeth or a library of smiles in order to determine what smile Amy would like. As we can change the color, we can change the shape, we can change everything on this until we get to the point where we're all satisfied with what we're shooting for, and at least we have an example then of what Amy could look like. So there she is. Okay, now that's a simulated smile. That's not Amy. But this is. So it's an interesting story. So Amy's proud of her smile, of course. And so she puts her picture up on Facebook. Guess who sees her? Her high school boyfriend. High school boyfriend is in California. Her high school boyfriend says, you have the nicest smile. In fact, it's the same smile that I remember when you were in high school. Guess who's back together again? Isn't that neat? See, it isn't the teeth. It's what happens as a result of the teeth. There are life-changing experiences that can occur. And I've seen people get better jobs. I've seen people establish relationships. I've seen people leave their homes because there's a number of people who just are recluses because they don't want to get out in society. Or even just being able to chew what you want to and choose whatever you want on the menu when you go to that restaurant. So we talk about technology because there is a difference here. When a patient comes in to see us, we're not just looking at you and putting in dental implants. We're evaluating. But once you leave, we're also doing surgery on the computer before we ever do surgery on you. And we create something called a surgical guide so that the implant goes in the exact same spot as it did when we designed it on the computer. So that's an example of a surgical guide or a digital mock-up of that. That becomes a surgical guide through some 3D printing technology. So that's where the implants would be, and that's where the implants really are. So that we have the opportunity of precision. and creating as perfect a result as we can. Now, eventually teeth will go on top of those implants. People are afraid of goop, the traditional impressions. Well, there are goopless ways now. We use cameras, digital cameras. And so we can eliminate the goop in an awful lot of cases. You don't have to worry about that material going back into your mouth. There's a camera that my son is placing in the mouth right now, just taking a video of the teeth, and that translates by computer into a model. And there's a model, and in this case there was a single implant. The single implant is going to be replaced by a tooth, and so you can see that on the digital model. There's the tooth. There it is in the mouth. So that's what we're looking for. We're looking for a natural appearance. We don't want you to even know which tooth is the dental implant, and I dare you to be able to determine which one it is. Well, maybe you can see it a little bit. But there's also people, and you may be wearing these ugly looking partial dentures. Well, they don't have to be that way. They sit in the mouth, they're full of plastic, they accumulate junk. But we can go to this. That's implant supported teeth. Those teeth look pretty good, huh? Yeah. Now, there are a lot of success stories, and you look at Eddie, and Eddie says, listen, I need something. I just can't do this anymore. I'm forcing my smile, and I'm only forcing my smile for the camera. Otherwise, I'm just hiding my smile. So this isn't the way Eddie actually looks. He's forcing a smile so that we have something to take a picture of. But there he is. Nice, natural, comfortable. And the befores and afters are significant, as you can see. It does make a difference. It does make a difference. And you can look, you can look more, you can have that comfortable look once you have teeth you have confidence in. Well, John came in, and John, you talk about somebody who wants to shy away from society. John is a night watchman. So he's a security guard. And as a security guard, he didn't have to face the public because he's doing his security guarding while the facility is closed. And then he's home for most of the day. John decided he needed to get something done. We talk about money and how much it costs, and I think some of you know how much a security guard possibly makes. And so John looked at it and he figured out how to do it, and then he did it. And so there he is in the mock-up, and you can see he doesn't know what to do with his mouth, but he knows what to do with his mouth now. You see, it can be done. And now John has relationships that he didn't have before, simply because he has teeth. Now, Steve came in. Remember, we talked about the fact that diagnosis and treatment planning is as important as the surgical procedure. So you look at Steve, and Steve comes in. Here you do those dental implants. I want those dental implants. Let's take them out, get the dental implants in, and I want to have a nice smile. And I looked at Steve after looking at the x-rays and after doing the examination and told Steve, no, you don't need dental implants. Steve said, I want some white teeth. I said, well, we can do that using your existing teeth. And that's what Steve ended up with. And Steve likes that. And Steve never had a dental implant done because he didn't need it. And he could create just as good a result, in fact, a better result, because he's using his natural teeth. And those natural teeth means that it's a smaller prosthesis, and it feels more normal than the prosthetic teeth. I'm not saying the prosthetic teeth are bad; they're not, but natural teeth are better. Peggy came in, and Peggy had a number of different opinions. Peggy's a nurse, and she's treating patients, and she's been told a number of times that nothing can be done. Well, you take a look at Peggy's mouth, and you see that the front teeth are prominent. You can see that a little bit. And you can see that the teeth are malpositioned. They're sticking out a little bit. They just don't look the way they should. If I had just taken out the teeth and put the implants exactly where the teeth are right now, she would have looked pretty much the same. And so there is some treatment planning involved. There is discussion involved. We have to look at what we can do to not just put dental implants in, but to reshape the mouth so that we can create a result that looks like this. So yes, there's a certain amount of sculpting involved, a certain amount of plastic surgery that's involved in order to be able to create something like that. So Now, Peggy, of course, just look at the relaxed position, the relaxed smile, and how Peggy looks and how comfortable she is in her new smile. Dental. This is a totally dental implant supported smile. Now, this person comes in, and you could have extracted any one of these teeth, but you know what? She was actually functioning on them. I mean, they were so loose. I don't know exactly what we would have done, or how, not what we would have done, but how she could function on these. She couldn't. She had to lose all of these teeth. These teeth had severe periodontal disease. So you take out these teeth and you create something like this, and all of a sudden, the patient, this person, can function normally again. She can choose something again. That's what we're looking for. Comfort and function. Good smile. That's what we want. And it's just a matter of getting together and determining what we need to do to achieve that. So I hope you've enjoyed this brief overview. If you'd like to get in contact with us, just give us a call, 321-259-8000, and we'll be happy to see you. Or I'm sure there's going to be a link that you can click on, and you just click on the link, and we'll be happy to correspond with you, even if you're not ready to come in. Thanks for joining us for this webinar. I hope to see you soon. Bye-bye.